Okay, hello everyone. It's just about 12 o'clock, so we'll get started now. Welcome to today's webinar session, and the topic for today is tobacco use in LGBT communities, preconceptions, challenges, and experiences. And our guest faculty is Juan Vega, and he is with the LGBT Health Link. Now, if you are interested in obtaining a letter of completion for today's session, you must have registered and completed the pre-learning assessment. You must sign in to view the live webinar session using your first and last name. So if you've signed in as a group, you can just email me by end of day today with a list of everyone's names, but you must have individually registered for the session to be eligible. Then following today's session, I will be sending out the link to the evaluation and post-learning assessment. These webinars are being live tweeted on Twitter. Follow the CAMH Nicotine Dependence Services at PS Quit Smoking. To follow the live tweeting or to post your questions, please use hashtag #TeachWebinar. Juan Carlos is a librarian and public health professional dedicated to identify opportunities, convert them into actions, and create change at the local level. His involvement with the health promotion and health disparities began in 2001 when he transitioned into the nonprofit world after 10 years of working for academic libraries and the Library of Congress in Washington, D.C. His experiences in health issues include tobacco, alcohol, cancer, obesity, family health, and health disparities. As a policy manager for LGBT Health Link, one of 8 CDC-funded cancer and tobacco disparity networks, he helps advance LGBT health issues primarily by linking people and information, including helping to train state health departments and medical providers in LGBT cultural competency and forge bridges between them and local LGBT health advocates and community expertise.
You get a hello from Yadi?
I signed in as Yadi, but my mouse, you can see, like, my computer is not.
Okay, so I'm hearing some background noise. I'm just going to move everyone. Juan Carlos,
Conference is now in silent mode. All participants are muted. Press *1 to unmute your line.
Juan Carlos, before you begin, please be sure to push *1 on your phone. Okay, and there are no disclosures to report. The TEACH curriculum and slides were developed and compiled with funding from the Government of Ontario, Ministry of Health and Long-Term Care. Contents from slides were primarily based on evidence-based guidelines from the following sources. These materials, as well as the verbal presentations and any discussions, set out only general principles and approaches to assessment and treatment and do not replace the need for individualized assessment. Okay, now before I hand it over to our guest faculty today, I'm just going to ask the group some polling questions to get a sense of the group today. So the first question is, what is your current discipline? It's a very long list, so there is a scroll bar at the end. Okay, so it looks like the majority of you at 35.7% registered nurses. Thank you for participating. The next question is, if I can get it, what region does your organization serve? Okay, so majority of you, 24.4% from GTA. And the last question is, what type of organization do you work for? Okay, and just about 30% are from public health unit. Okay, great. So that's all the polling questions. I'm going to hand it over now to Juan Carlos.
Great. Thank you. Can you hear me okay, Tanya?
Yes, perfect.
Okay, great. So I want to say, first of all, thank you to Tanya and the agency for facilitating the opportunity for us to discuss tobacco use in LGBT communities. And I want to thank also the HealthLink and CenterLink staff that make possible that I am able to present to all of you and share what we have all learned of hard work by engaging departments of health as well as community-based organizations and other stakeholders. So for today's session, we're going to be discussing and describing smoking and related disparities in LGBT communities. We're going to see some of the challenges and preconceptions on the LGBT experience when it comes to smoking cessation and tobacco control in general. And we are going to identify strategies that many of you providers, as well as even if you're not a direct service provider, but you are a public health worker, educating and making accessible resources, we will be providing some strategies that we are using in different localities in the U.S. and that have been successful and that they're always adaptable at the local level. So defining our terms. So who are we, right? LGBT communities. They're actually, we are used, instead of LGBT community single, we use plural because LGB refers to sexual orientation while the T refers to gender identity. And there are a lot of different terminologies that are used to define LGBT communities, like the Q for queer, A for asexual or ally, the T can be transsexual, intersexual uses the I. So there's different terminology that are used depending on each locality and each community, how they identify themselves. But for the purpose of this presentation, this is the main terminology that we're referring to when it comes to LGBT, okay? And one of the important things when we're talking about LGBT communities is that for years there has been a heavy burden in our communities. We have faced isolation, violence, discrimination, and really the benefits and policies are not always equitable for us. And not just from a perspective from the United States, but from many places in the world, even though we are evolving, right, and policies are protecting people based on sexual orientation and gender identity and self-expression, the reality is that there's still stigma and discrimination, even if those policies are already in place. So, but it is important to understand that LGBT communities do have many structures that are already in place that support people locally, and with health services, legal services, and just, a platform for people to be, and especially when LGBT communities, there's so much homelessness, these are spaces that hold LGBT communities, and there's always, in every locality, there's usually some type of leadership. So, but there has been, because of this stigma and discrimination, there's a lack of sense of trust with institutions and the government. So when the health department wants to talk to LGBT communities, there's a level of mistrust, just like it happens with other disenfranchised communities and populations like immigrants as well as, other communities. So the important thing is that I'm going to show you that disregarding of the challenges that we face as communities socially and in terms of health, we're also an untapped resource that can change positively, not just the health of LGBT communities, but for the health of the people that you're working in your locality. So we're going to take a second to watch the video produced by the Centers for Disease Control here in the U.S. Regarding smoking within the LGBT community. Tanya, take it away.
Smoking is the largest preventable cause of disease and death in the United States. Lesbian, gay, bisexual, and transgender Americans smoke at much higher rates than average, so they suffer more smoking-related death and illness. Dr. Scout directs the Network for LGBT Health Equity at Centerlink. Here, he talks about what smoking does to LGBT communities.
Unfortunately, lesbians, gays, bisexual, and transgender people don't even realize that we smoke more than other populations. And at the same time, the tobacco control movement often doesn't realize we do too. As the next generation comes out and tries to find their leaders, they see people who are smoking, and it keeps, it's really like a socially transmitted disease. While many of us are really outraged, a lot of us do not understand that we even have a disparity.
The tobacco industry has a long history of marketing to the LGBT community.
There's a lot of community gratitude for the tobacco industry, which has moved in early and swiftly to be LGBT community supporters. We also saw the tobacco industry spending more money on telling us how great they were with our rights and issues than they were even spending on supporting us. And we've seen the industry twist our civil rights issues to look like that freedom to smoke is like civil rights for LGBT people. We also really need the regular tobacco control programs to routinely include LGBT tailored work. I mean, we have a huge history of discrimination against us in the healthcare arena, which means that we're not going to trust you unless you prove that you're different than the history. So if we see the policymakers prioritize LGBT tobacco stuff, that will be one of the best ways to help the community realize it, get educated, respond, and build the infrastructure as well.
This video is a production of the Office of the Surgeon General and CDC's Office on Smoking and Health.
Okay, so that's the perspective from the U.S. federal government on where we are with smoking within LGBT communities. And these are the Institute of Medicine report, not just the Centers for Disease Control, the Healthy People 2020 plan to make our community, our nation healthier. They are all understanding and state clearly that LGBT individuals' first barriers that affect their health care and their overall well-being, and that in order to be able to facilitate health care properly to LGBT communities, it's important and essential that we understand that to understand the history of oppression and discrimination, that, when a transgender woman is going to try to get health care, she's not thinking about the health care that she has to take, that she needs to receive to be well, but she's thinking, are they going to be discriminated against me? Is the person sitting behind the desk taking my information going to force me to use my another gender besides the one that I want to use? So these are things that all of you that are, having direct or indirect contact with LGBT communities need to understand, that beyond any direct service cultural competency that, the medical providers and the staff understand how to best, provide better resources for LGBT communities to be healthier, it is very important to understand just the basic history of how LGBT communities have been treated. So in general, different disparity populations have different issues that are specific to why they're in a disparity. So when it comes to LGBT individuals, it is estimated that 20 to 30% of LGBT people abuse substances compared to 9% in the general population. And when it comes to, it includes alcohol, and in terms of other substances, I will tell you a little bit later, but when it comes to mental health issues, the blue bars are LGB, it doesn't include the T, and the red is for heterosexual. And you can see how the LGBT communities always had a higher prevalence when it comes to psychiatric disorders. When it comes to, mood and anxiety and so on, you see that there's some health disparities that are already working against us. When it comes to insurance, at least in the U.S., LGBT communities need to be insured in order to receive proper care. Most importantly is this map right here. In the U.S., any state that is in purple color protects. They have laws that cannot allow for discrimination to happen based on sexual orientation and gender identity. Only on the purple states, right? So on the pink states, which is a smaller selection, they do have protections for sexual orientation, but none for gender identity. So transgender individuals are not covered. So in all the other states in white, there's no state discrimination, non-discrimination law to protect against either sexual orientation or gender identity. So this is the perspective that we're looking at when we're trying to receive and provide health care. You can be discriminated based on where you live, and people can deny service because of who you are. So understanding intersectionalities, right, is, often used in critical theories to describe the ways in which oppressive institutions like racism, sexism, transphobia, xenophobia, classism are interconnected and cannot be examined separately from one another. So when we look at an intersectional lens, you need to look at all these factors to truly understand an LGBT health and be able to work with it, right? And it pushes away the, the norm that communities are all, LGBT communities are all homogeneous, when in fact it is essential to note that the health needs for an African American or a black lesbian woman are not the same needs, perspectives, and realities than a Caucasian gay male, or in my case, a Latino gay man. So you need to take into consideration many of these intersectionalities in order to understand better LGBT communities within that broader perspective. So when we talk about, one of what we consider here in LGBT health things, the main disparity that are affecting our communities is that the National Adult Tobacco Survey data found that LGBT people smoke at rates 50% higher than the general population. And this was published in 2013 when the Morbidity Mortal Weekly reports were published by the CDC. So did you know that discrimination is associated with smoking status among transgender individuals? In October 2015, a recent study published that there's evidence that transgender individuals smoke at significantly higher rates than the general population, and it was due to structural or everyday discrimination experiences that are predicting the smoking behavior among transgender individuals. So when we're trying to, talk about why are LGBT communities smoking more, why is this disparity such an issue? And as I've been talking, we believe that stigma is the main reason. Discrimination is all too often the case with LGBT communities. And when you're homeless, or when your parents throw you out of the home, or you lose your job, do you think that you need something that is going to make you feel better? So substance abuse is just easy. A cigarette is the most accessible way for you to reduce the stress from stigma. And unless we deal with stigma and discrimination, we will continue to see how that influences the use of substances in our communities. So imagine you are a young person in today's society with all these technologies, so you don't have the latest iPhone, and you need to perform in school, and you need to have sports, and Facebook puts a lot of pressure on you, and on top of that, you have to come out to your parents, and you have to come out to perhaps, your high school friend, so that he stops asking you why you don't have a girlfriend. So these kinds of things are stressors that are put in LGBT youth and that lead them directly to substance abuse, including tobacco, right? So when you think of LGBT communities, you think of, where are we? Where are we located? And in reality, when you think of where are LGBT communities in your location, the first thing you think is bars and clubs, where drinking and smoking, even if the laws prohibit smoking indoors, are, happening and are tools that are used to socialize and meeting people. So we have to think that historically that's our outlet. That's where LGBT communities are. So for decades, the tobacco industry have targeted LGBT communities just like it targets other communities. And they do it in many wonderful ways. And like Dr. Scout mentioned in the video, they use our civil rights and make them into looking like pro-tobacco messages. But they have been targeting for decades during pride events, bar promotions, ads, and providing money for community-based organizations. So this is my favorite of all the images that we use here on LGBT Health Link to show you the ads that the tobacco industry has been using for LGBT, to target LGBT communities and to gain new smokers. And this is a photocopy from the Tobacco Legacy Documents Library in the University of California in San Francisco. And this is the title page of the marketing campaign called Project SCUM. And SCUM was subculture urban marketing, and it was focused on the gay community in the Castro district and homeless people, both in San Francisco. So they were targeting, this was a marketing plan to target these communities, but at the end, Project SCUM, that's how you consider LGBT communities, is SCUM, and that's how you consider homeless individuals, is SCUM. So this slide represents the reality of how the tobacco industry engages and tries to approach LGBT communities, even if they are trying to engage with our civil rights issues. At the end, this is what they think of us. When we think of general ads, this is Parliament ads in the 90s. This ad was placed in Details, Cosmopolitans, Penthouse, and so on. This guy is looking at the lady right there in the pool, but then this ad appears in Out magazine, and all of a sudden, this gentleman appears right there in the middle. So who is he looking at? Is he looking at him or is he looking at her? So the ambiguity is good for tobacco industry marketing that says we are paying attention to LGBT communities. So here are other examples. This is a more recent example of snus, which is chewable tobacco, and you can see the rainbow flag right here, and telling us that the tobacco industry really care about us. And then this is an ad. This is a photograph that I took of a smoke shop, because now, right, cigarettes are restricted, so a lot of smoke shops are coming up. And the smoke shop is located in the Wilton Manors neighborhood in Fort Lauderdale, Florida, and it is 1 out of 3 in about a quarter or half a mile space. So tobacco is still very much, it doesn't matter in which form, it's very, very much present in our communities. Right here, Oregon stated that 29% of LGBTQ adults in Oregon have received tobacco coupons or other discounts through the mails versus 17% of heterosexuals. And then this is an ad in around year 2002, appeared in Europe, a very appealing ad for, gay men, transgender individuals, very good. But in reality, that those good-looking images, those appealing ads, what they're actually trying to do is just sell us this right here, the cigarettes. And that's the problem, that then it continues, that good advertisement makes us believe that, that they're good for us, but they're not. So pride events, this is Miami Beach Gay Pride last year, exactly 1 year ago. Look who one of the major sponsors was, Vapor Shark cigarettes, electronic cigarettes. Even though they're not directly associated with the tobacco industry, we do know where that's heading. So I believe my video has stopped working. So I see what I look like now when I stop, but I'm going to see if I can try to fix that. And here we go again. All right, so then right here, we are looking to talk to people about smoking coming out of the closet. Since 1964, the U.S. Surgeon General are like, chief doctor, basically. There has been a report since 1964 talking about smoking and health. And it wasn't until the year 2001 that we finally were mentioned, LGBT communities were mentioned as a disparity. But it wasn't until like 50 years later that in 2014, it is clearly delineated as a disparity. So it took 33 Surgeon General reports to be published, and only 3 mentioned LGB or LGBT. So when the government and institutions are not understanding the realities, how are they going to invest resources at the local level? So what are some of the strategies to reach out to LGBT communities? And many of you that are working in hospitals and clinics and public health departments of health engaging for education. So let me provide you with some strategies to understand the access to barriers, enhance the welcome, and create safe and friendly environments for LGBT communities. So how do we create an LGBT welcoming environment? You need to see and be conscious of your environment. Can you identify from looking if somebody's LGBT? You need to question yourself. You need to question your assumptions as well. You need to be careful with language choices. Those pronouns, don't assume that I'm a he because I have a beard. It's better sometimes to ask so that you know what is the best, what is my pronoun of preference. Challenge your own biases, okay? Do not dismiss. Always remember that, LGBT people, when they walk in for the first time, there's probably a sense of not feeling comfortable because I don't know if I'm going to be discriminated against. But so take that into consideration when you are serving your clients or patients. So be aware, that perhaps you need to put some images around so that you can make it safe. So is it safe for the employees in your organization to come out? Is it a welcoming environment? Do you have your house in order? Can LGBT individuals focus on LGBT work, or can ally individuals focus on LGBT work to improve the health of LGBT communities and not feel threatened? Okay? Do you have a mechanism to use your LGBT employees as in-house experts to work with this population? Right? So these are all questions that you need to ask yourself. Are you collecting LGBT data? Recently, with the wonderful collaboration with the National Jewish Health Quit Line, offered free field testing for this enhanced measure that we are presenting. So different surveillance measures, different information based on how the questions are asked. So sometimes, and right now, most of the time, LGBT communities are measured 2 different ways. One is sexual orientation, and the other one is gender identity. So like 2 different questions. So this new measure that we are considering is integrating other measures that have been tested in the past in various quit lines and that have had some success, but not always. So what we're looking to do is to make sure that the important thing is that you are collecting LGBT data, and there's a lot of ways of making sure that you are collecting the LGBT data. So, when you're doing promotions and when you're doing campaigns, you always need to think of LGBT audience if you're trying to reach out to this population. So the thing is that this ad was placed out by the CDC, and it said, quit tip. Thinking about quitting? Try to find a friend to join you. You're more likely to succeed if you have someone on your side to support you. This is the image, and this is the message that appear in Facebook from the CDC. So here in HealthLink, our awesome social media people, we move the conversation a little bit to make it LGBT friendly. Thinking about quitting, try to quit with your partner, because we have 2 women here. You're more likely to succeed if you have someone on your side to support. So always think that you can use the current ads in order to make them accessible for LGBT communities. So right here, this image of these ladies in here are the Quit Line ladies that go every year to a North Carolina Pride event. And they come in this little van, and the people at the Pride event are waiting for them to arrive. Where are the Quit Line ladies? So the North Carolina Department of Health is directly engaging LGBT communities. And then California decided to create an infographic specifically how lesbians and gay men smoke 3 and 2 times more than straight women and men respectively. But they're showing it and publishing it. And then the New York Department of Health, along with community-based organizations, decided to create a New York LGBT smoke-free initiative. And the New Mexico Department of Health, in celebration of Pride Month, decided to include the rainbow flag in their logo, just like Vermont did. So these are ways of departments of health showing, or institutions. It doesn't have a department of health. It can be a hospital. It can be a clinic. It can be a community-based organization where, in celebration and support of Pride Month in your locality, whenever that is, you can make your logos rainbow. You can make your logos with rainbows, or just write proclamations that are making LGBT communities feel safe. So right here, this is a billboard that appeared in the highways of Indiana when a few years back the governor of Indiana was about to pass really harsh policies, like it's happening right now in some states, against LGBT individuals. But on the other side, this ad has Ellie and her partner talking about secondhand smoke, because Ellie is a singer and her partner smokes. So how can, while the government is doing something, locally there are other things happening, and the important thing is that there is collaboration even when their climate is not always favorable, right? So this was put out during Pride Month by the CDC, supporting healthy and smoke-free prides. And this is one of my favorite ads, and it comes from the Idaho Department of Health. Can you hear me? Hello?
Yes, you're back.
Okay, I'm back. All right, hold on 1 second. Can you hear me?
Yes, now we can.
Okay, there we go. Sorry about that. So right here, you see what the Idaho Department of Health did to include transgender individuals and support them in their quitting date. This was a local performer and transgender leader and another local leadership that used their images as champions to have LGBT individuals quit smoking. So this is what New Mexico Pride did. And in New Mexico, right, the culture uses a lot of chilies, right? So right here, when you look at this ad, it is actually talking bisexual and smoke-free. Some like both. So these are very interesting messaging coming, and you include right here 1-800-QUIT-NOW. as well as the Spanish language version. So this is just very interesting images and campaigns that can happen, and you can copy and adjust for your local initiative. So right here, this is a community center in Pennsylvania put out this, LGBT health alert, and it was talking about cancer, but they're also engaging in smoking and tobacco control. So right here, again, integrating different kinds of language. You're in Puerto Rico. If you smoke, you lose your erection, and right here is the website of where you can quit. So then when you, on the back, leave cigarette, here's the cessation line, the Department of Health, but when you open it, you have a condom inside. So you're integrating certainly messaging, HIV, STD prevention, sexual health, as you're discussing tobacco and smoking. So where do you engage LGBT communities locally? Where are the queers in your community? We are in many places. You are not necessarily going to find the signs that say LGBT outside the door. Some do, like LGBT community centers that there are in many localities across not just the U.S., but Canada and the world. They're social and support organizations, but you need to engage the local leadership to know about it. There's churches, of course, the bars and clubs. There are places that even though people smoke and drink, those are places where LGBT communities gather. Universities usually have resource centers, and you need to find us on print media and social media outlets. We are really engaging in various platforms where health messaging can be sent. So identify your local LGBT community centers. So HealthInc is part of CenterLink, your community of LGBT centers, and this is a photograph of our website homepage. And the important thing is that there are, among our members, 4 community centers located in Canada. Unfortunately, none of them are in Toronto. That does not mean that there may not be, that there is local LGBT leadership in Toronto, but know that there are already existing institutions that you can engage directly to perhaps provide smoking cessation support groups or smoking education in your community. So it is essential that you contact these members and most importantly, going back again, identify where is your local leadership. So in general, I want to provide you with conclusions that you can directly answer right now as I go through them, and you will know if you are properly incorporating strategies to work with LGBT communities in your practice or programs. So it is essential that when you think of these strategies, you're not going to be able to do them all, but I guarantee you that you will be able to identify at least half a dozen of them that you can incorporate into your work in some way or the other. And very important is that this engagement, you don't do it alone, but that you look for your local leadership, that you look around in your workplace and in your office setting and identify LGBT individuals that can help you and direct you with the work. And once again, you do not need to be an LGBT individual to work with LGBT communities, but for sure you need to be an ally of LGBT communities in order to be able to engage us properly. So, do you recognize the barriers that LGBT communities face when accessing healthcare services in your location? Can LGBT employees or allies feel safe including LGBT-focused work? Yes or no? If they can't, how can we fix that? Is it fixable? Do your work organizational environment provide a welcoming environment for LGBT people? Can employees, volunteers come out of the closet safely? Do you co-brand with LGBT trusted groups? And it can be with the national organizations, or it can be with local organizations, or it can be with international organizations. Do you know and promote through LGBT media channels? Do you include LGBT goals in your action plans? Do you ask your partners or grantees to do the same? In your evaluation, do you include LGBT measures? Can you identify LGBT individuals? Do you have LGBT people included in your community or advisory board? If your answer to this one is no, I'm going to assume you live in a rural area where it may be harder. But if you're living in urban area, you have a lot of access to LGBT individuals because it tends to be that in urban area, there's more visibility for LGBT individuals. So if you live in an urban area and you don't have community and advisory roles for LGBT people in your work, then this is a very easy one to begin the engagement. Is your health promotional material an office space in your office? Do you have a rainbow flag? Do you have imagery that it accepts LGBT individuals? If you don't, I provided you with some examples that you can implement in your localities, but also I will show you some more that you can order as well. Do you collect LGBT resources for referrals? You're trying to work on tobacco cessation. You're trying to help people quit smoking or stop using substances and live healthy lives. But you cannot talk to somebody about that when their first concern is finding a roof because they got kicked out from home because they're gay or a lesbian woman. Okay, so when you're trying to this person to quit smoking and to understand that quit smoking is the best thing that they can do for their health, so you need to make sure that you're taking care also of the things that are their reality under present circumstance. So are you engaging youth and elderly LGBT individuals? These are, when you talk about LGBT communities in general, these are two subpopulations that get left out because the reality of gay men and lesbian women are very different from youth and elderly LGBT individuals. It doesn't matter if they're gay or lesbian or transgender or any other letter in the acronym. These are populations that are routinely left out. Are you collecting sexual orientation and gender identity data in your program surveys, forms, and evaluations? If you were able to answer half of those questions or 5 of those questions, several of them, congratulate yourself. You are engaging LGBT communities. Now look for the other ones where you can expand that engagement. And that's what LGBT Health Link, it's a project that is here to support and link people on LGBT wellness information. We promote the adoption of best practices in health departments, community-based organizations to reduce cancer and tobacco disparities, and we're funded by the CDC. And we have 99% of them are free of charge. We have trainings and webinars, provide technical assistance. In Huffington Post, Facebook, and Twitter, you can find LGBT Health Link, providing current health news and awareness information. We can help you with data collection, providing you models, sample non-discrimination policies, best and promising practices for tobacco and cancer control, link you with local experts. And we have some local experts in, different, provinces, but they may not be reflected in the map that you saw in Centerlink. And we encourage you to check our blog to see all the local stories as inspirations for you to work locally in your communities. So this is the best and promising practices that HealthLink developed to engage LGBT communities in tobacco prevention and control. in your chat box, they just sent the link, which is also reflected in the PowerPoint. And right here, it has the Network for LGBT Health Equity. That was the name we had before we moved into Centerlink, but we are the same network. And we are just pulling out some best practices to work throughout the cancer continuum with LGBT communities with a wonderful interactive phase that people can look and search, and we will be completing the complete PDF document uploaded in the next few weeks. So LGBTHealthLink.org offers a numerous amount of materials that you can order free of charge, and many times we encourage agencies and hospitals to co-brand with us. Like right here, we leave this space here, and we leave this space here, and we leave space here, so that you can put your logo on it, and you can put the information that you need to include in order to target your clientele. Just visit lgbthealthlink.org. So this is my contact information. You can find us as mentioned on web, blog. This is our Facebook, Twitter, email, and our phone number. So I think we are ready for some questions. Thank you very much.
So you guys can ask questions via the chat box, which I see some of you are already starting to do. If you have joined us through the teleconference, just push *1 on your telephone and you can unmute your line. Annette, there is the contact information as well. You can download the slides over here. Just click on the title of the slides and then go down to the bottom and click Download Files, and you can have the PDF copy of all the slides.
So I'm seeing some of the questions. Can I just go for them?
Yeah, for sure.
Okay, so should we be striving to incorporate cessation's efforts for the LGBT community into our efforts for the general community, or should we be providing such services targeted specifically towards the LGBT smoker? So our recommendation is that you actually develop specifically targeted services. And because of that history of, am I going to be welcome here? Can I talk in my cessation group about having my boyfriend versus having a wife? Is this comfortable? So there are some, already pre-established barriers that will interfere before even getting to the cessation work. So when you have a cessation group, that perhaps a local community-based organization is offering, and, a hospital or an institution is sponsoring, or it is happening actually within the same hospital, that's a cessation group for LGBT individuals under allies, then that says that you are welcome in that space, and then you won't have the barrier so that you can actually engage in what you're there for, cessation efforts. So that is our recommendation. You can also, in your general targeted for the general population, make statements that say we do not discriminate, or these are safe spaces, and we do not discriminate based on gender identity, sexual orientation, and so on. So it is, if you can do that, then that might make, that perhaps will bring you, into the general cessation work. So they're asking to put my contact information. There it is. How can we ensure LGBT individuals feel welcome and safe without excluding non-LGBT individuals? We are a service for everyone. So in reality, most of the time, so when we're talking about LGBT versus non-LGBT, when you think of that, is LGBT communities the one that has been excluded many times. I have been in many places where I've seen a cashier or a booth attendant trying to serve a transgender woman, and all they can do was just make faces and, note that they are uncomfortable with serving a transgender individual. So because that's what happens to LGBT communities, then the efforts should be focused on making sure that your staff and volunteers know how to work with a transgender woman, with transgender women. So it is essential that you teach your staff to understand when a woman comes in to receive health care, she may come in with her wife, which is of the same gender. And nobody's going to panic, nobody's going to freak out, and nobody's going to be giving weird looks. So those kinds of things are the things that do not happen to non-LGBT individuals. Another question says, please discuss strategies for working with LGBT youth and young adults who want to quit. Campaigns, excellent websites, etc. So they used to be called the Legacy Foundation, but right now they're called Truth Initiative. Look them up because they are one of the biggest partners we have with working with youth. Their focus is to work with youth, and they have several campaigns that directly engage youth, and pretty, interesting campaigns that are created and run by youth, and therefore appealing to that youth. And this is not anything that 45-year-olds like me would engage on when it comes to tobacco control, but for a 16 and a 15-year-old, they are having great opportunities to engage with youth. However, they're not specifically LGBT youth. I'm sure they incorporate LGBT youth, but to be real honest, there aren't really out there campaigns that are really good for LGBT youth. We are actually looking for that one. So there, again, I think the best way to approach and identify a good campaign would be if you identify those that are doing really good youth tobacco control work and engage them by, are you incorporating LGBT individuals? Are you incorporating LGBT imagery in your youth tobacco work? And if usually, that brings results, but again, you can engage directly in local community-based organizations and LGBT community centers. Most of them have youth-specific programs and support groups. So when you engage through them, right there you will have the specifics. Truth Initiative. Okay, I don't see any other questions on the chat. I'm not sure any other questions.
We'll just give it a couple of minutes to see if people come up with questions. Again, if you're joining us over the teleconference line, you could push *1 on your telephone to unmute your line.
I also, I see some people are typing, but there are always consider that wherever you are located, there's usually groups that are already engaging LGBT communities. So the essential part of, beyond understanding the stigma and how you can, improve your services so that LGBT communities feel welcome, it is key for hospitals and government agencies to directly engage LGBT communities just like they would engage other community-based organizations. You know, call them into your local coalitions against tobacco, against cancer, against substance abuse. Engage them directly because, again, unless they already know that it's a safe environment, they may not be participating because they're not sure if they're going to be welcome in when they, present themselves into what would be considered mainstream environments. So I see some questions. Can you identify other LGBT stressors that are common that we should be aware of other than stigma, that we should consider with smoking cessation? Stress often brings ex-smokers back to smoking. I think that one of the things that you need to consider is the environment where the individual is where it's living. Because smoking is so prevalent in LGBT communities, you need to, when somebody's trying to quit, is their partner smoke-free or are they also smoking? What is the situation in the household of the individual that you're trying to support to quit smoking, to cessation? So while you may be very successful during the cessation therapy support groups and the phone calls, then the individual goes home and is exposed to a different environment. So then how do we work with partnerships? How can we get them to come into cessation? And then also considering in the household, are there children, right, or elderly individuals that are more susceptible to the dangers of smoking? So that's, I would say that that's one that is very common, right, where, we are focusing on the individual, but then we're not really thinking that at home we may have that happening. So then, also think in terms of stigma, beyond the stigma aspect of it, think of what I was saying at the beginning in terms of the non-discrimination laws across the countries where there's a history of LGBT communities being discriminated against, decades, hundreds of years of this, and being isolated. So there's a history of, within LGBT communities, of feeling that don't tell me anymore what I shouldn't be doing. So when you're, going to another LGBT, when you're going to an LGBT communities and we talk to them about the dangers of smoking and how smoking is bad for you, we need to come from the perspective that they may be thinking, here is, people telling me once again that at one point I couldn't be gay freely, or I couldn't do this or that. Now I can't smoke because it's really bad for our communities. So, take into consideration that history of discrimination that has taken place when you're trying to, support people quit smoking so that they don't see it like, here it is, the systems and, the government telling me once again not to do something and be who I am. So take that into consideration when you're working on that. Then I see people are sharing some of the Canadian resources. And again, I don't know really any of the resources other than just some of the government agencies. So it is essential. I am learning what is happening locally, in every state here, but there isn't really a full list like you would find, every province and every city has a tobacco control program list, right? And you can find those lists. So you won't find necessarily LGBT community-based organizations that way, and you won't necessarily, find the resources again for LGBT communities as well. So I think that from there, I'll pass it on to Tanya. Not sure if there's any other questions.
Yeah, if you guys still have questions, please continue to type in the chat box, and I will compile the list of questions following the webinar. Thank you very much, Juan Carlos, for facilitating the presentation today. And I just want to remind you all that the link to the evaluation and post-learning assessment will be sent out today by 4 p.m. And it is required if you want to receive a letter of completion. And we want to thank everyone for attending today's presentation. We hope that you found it enjoyable. Please do fill out the evaluation form as we do take those into consideration with future curriculum development. Okay, and our next webinar is scheduled for May 25th. The topic, it will be physical health and tobacco cessation, but the registration is not yet open. If you are interested, you can visit our website at teachproject.ca. So thank you all again for attending. Thank you, Juan Carlos, for facilitating, and we hope to see you at the next presentation.
Yes, thank you very much, Tanya. Thank you to everybody, and I sent a lot of sun from Fort Lauderdale, Florida, to all of you up there in Canada. Bye-bye.
Thank you. Bye.